Petrositis. Before going into the topic, let me give a small introduction. Let us go through the structure of the ear. Ear can be divided into three parts: external ear, middle ear, and the inner ear. The infection of the middle ear is called as otitis media. It can be acute otitis media when the duration is very short, and chronic otitis media when the duration is more than 3 months. And complications of otitis media is more common in acute otitis media. First, what happens is infection from the middle ear, it spreads from this part to behind the ear, part behind the ear. This is also part of the middle ear. So this part is called as the mastoid air cell system. From here, the infection can spread inside, means into the brain, structures which are related to the brain and involving the brain also, or it can be spreading outside, that is to the face or through the neck. So if you see this model, this is the ear. So if you go straight inside here, we can see the tympanic membrane or the eardrum, and behind the eardrum you have the middle ear. So the part behind the middle ear, this is a mastoid air cell system. This is the mastoid. So when infection spreads from this mastoid, from here, it spreads and goes inside, it can involve this part. This part is called as the petrous part of the temporal bone. This whole part is called the temporal bone, this part. So this is the petrous part of the temporal bone. So at this stage, if you ask me what is Petrositis, it is infection of the air cells in the petrous part of the temporal bone, which is secondary to otitis media. Here in the petrous part, there are two important cranial nerves. One is the fifth cranial nerve, the other one is the sixth cranial nerve. So when you have infection in the petrous part, it can involve these cranial nerves. So when the fifth cranial nerve is involved, the patient complains of severe pain behind the eyes, retroorbital. And when there is infection involving the sixth cranial nerve, the patient, he complains of double vision, which is called as diplopia. So let us go into that. Now the patient complains. He says that I have been having ear infection for a long time and he has got a ear discharge. And of late there is pain behind the eyes, and when I see in one particular direction, I get double vision. So these are the complaints of the patient. These are three most important complaints. That is discharge, deep retroorbital pain, and double vision. So on examination, first we have to clean up the ear nicely. We remove all the pus which is coming out from the ear by suction, and we can put in an endoscope in the ear, and we can see that the eardrum, there is a hole and pus pouring out from that. And on ophthalmic examination, or when we examine the eyes, when the patient turns in one particular direction, he sees vision. When he turns in he looks at one particular direction, he complains of double vision. So that confirms our clinical diagnosis of Petrositis. Coming to the investigation, these patients need to be admitted, and when you do a total count, a differential count, it shows infection, like the blood counts will be high. Likewise, we had to do a renal function test too, because we have the patient for CT scan. So prerequisite for a CT scan, the renal function should be normal. Why? We do a CT scan, it is high resolution CT scan with a contrast. So when you do a contrast, we have to make sure the kidney functions are normal, because this contrast can affect the kidney, that's why. So once it is done, we do a CT scan, we can come to know that there is infection in the middle ear, that is the middle part tympanum, and the part which is behind, which is called the mastoid air cell system, and you have infection in the petrous part of the temporal bone. Now to reconfirm this, we can do a bone scan, that is a technetium scan, which also will show that there is infection there is bone involvement in the petrous part. This is a bony part mainly. And if not, if we don't do a bone scan, we can do a new scan that is called as PET scan, positron emission tomography. That also will show that infection in the middle ear as well as in the petrous part. Now when the diagnosis is confirmed, anyway we have started with antibiotics. So we'll wait for 2-3 days. If there is marked improvement in the patient complaints, he says that discharge also has come down and eye retroorbital pain also has come down, then we need to continue the antibiotic. So along with antibiotic, we'll be doing ear suction every day, and we'll be applying ear drops too. 3 drops 3 times daily for 5 to 7 days. And do not forget, we have already sent ear swab which has been taken, and we have sent it for culture sensitivity. It will show which particular bacteria is involved and which antibiotic can be given. If needed, we can change the antibiotic specific to that bacteria. Now, along with this, we need to have a nasal spray, nasal drops, and antibiotic started, and ear drops is also going on. And of course, there will be painkiller also. In case the infection doesn't subside in 2-3 days, it has become worse, we need to do surgery for this patient. So what is the surgery? Like how I mentioned before, the infection in the just behind the eardrum and the mastoid ear cells. So we have to open up behind the ear, and we have to remove all the mastoid infected air cells completely, and behind the eardrum too. Clean up everything, remove all the pus, everything. Most of the cases this will be enough, but suppose infection is very severe in the petrous part, then we need to involve the neurosurgeon too. So it will become a teamwork, ENT as well as neurosurgery. Neurosurgery, they will be taking a separate route, or they are doing a transmastoid route, they will be helping us too. And we have to clear up the infection which is in the petrous apex. So soon after the surgery, you need to continue the antibiotic for a few more days, and the ear drops of course. With that, we can get a control of the petrous infection. Now, this is in short about Petrositis. Thank you so much.